Hello, my name is Michael and I am your clinical preceptor today. I am a clinical nurse. Can you tell me your name and what you can do as a student nurse?
Hello, nice to meet you, Michael. My name is Laura and I am a first-year student. I have a list of clinical skills I can perform, but we cannot do medications yet as that is in second year.
Well, that means you are pretty useless then. I will just use you to do all the horrible jobs I do not want to do. You can make all the beds, shower all my patients, clean up urine and faces and all adults for me.
We need to practice other clinical skills like blood pressure, temperature, pulse and respiration, blood sugar levels and other skills on the list I gave you.
Well, if I can be bothered finding some of that for you, but we will see how much time you have left after you are doing all of my other crappy jobs I do not want to do while you are here. We love having students here.
I also would like to get an opportunity to perform cardiovascular, respiratory and neurological assessment as we just did those at university this semester, and I would like some real-life practice with these clinical skills.
Yeah, right. What do you think? You are a doctor? I do not even know how to do those, so I do not like your chances. Oh, by the way, do you know what a S3 sound is?
We were told at university that a nurse should have good health assessment skills and we need to practice this on clinical placement. A normal sound is lube dub. Lube is the S1 sound and dub is the S2 sound, and an S3 sound is another sound, lube dub dub for example.
Thanks, I will go and make out to the coordinator that I knew that. Now get on to showering my patients and making all the beds. Oh, and clean up the faces in room 3 because I could not be bothered.
Where are the gloves?
We have used too many gloves this month, so the facility manager has told us we cannot have any more until next month.
Are you joking? I am not doing anything like cleaning up faces without gloves. What happened to standard precautions?
Standard precautions do not make money, plus when we have students we find we go through double gloves as you students use gloves for everything. Our center cannot afford that many gloves, so you should just use your bare hands like we do. I suppose I can go to the kitchen and get you some catering gloves if you really need it to clean up that poo in room 3.
I will bring my own gloves tomorrow. I am going to do the shower in room 1. Should I get the hoist to ambulate her?
No, that wastes time. Just go and pull her out of bed. She can walk, she is just being lazy.
But the OT has assessed her as a to assist with a hoist as she has an amputated leg as she is diabetic.
She is really good at hopping. Just pull her leg out of bed, help her up and make her hop to the shower. That will save you time so you can get 3 showers done before breakfast.
Breakfast is in 30 minutes. There is no way I can do 3 showers in 30 minutes as all the patients need help with ambulation. 2 are supposed to be hoists and the other needs to have plastic covers on her wounds.
Just get it done. The time you were taking here crying to me, you could have done a shower in that time.
Are you going to come with me to assist with the ambulations? We are not supposed to shower patients alone as we are just students.
No, I am going to go and text my friends on my iPhone. That is stupid. You can go shower them alone. Now leave me alone or I will tell your clinical educator that you are not a team player and you always argue when I ask you to do things.
Alright, but I am not getting paid for these 3 weeks to work slave labor and do everything that goes against everything that we learn at university, and it puts the patient and me at risk.
Keep it up. I can phone your clinical educator now if you like. Just go and do what I say or I can find you more horrible jobs if you like.
No, I will do it. I cannot wait until I am finished, and I will never treat students like this when I am a preceptor. What has happened to scope of practice, code of practice, code of ethics and all the other guidelines for nursing clinical practice that we learn at university?